You are listening to Pharmacy, IT, and Me, your informatics pharmacist podcast. Welcome to another episode of Pharmacy, IT, and Me. And as with every episode, we start off this one stating that the intended audience is everybody. So today we'll be speaking with our special guest, Director of Pharmacy, Marie-Elsie on what her role is in the pharmacy technology and informatics world. So thank you so much for taking some time to be on the podcast, Marie-Elsie. How are you doing today?
I'm doing great, Tony, and thank you for inviting me.
Yeah, of course. And actually, I'm really interested to hear more about your role because it sounds like, from what I could tell, you've been doing a lot as not just a director of pharmacy, but also being in charge of, a lot of the informatics projects.
Yes, it is quite a lot of work to do the pharmacy directing and the pharmacy management as well as the pharmacy informatics. But I manage that a bit by delegating a lot. And now it's even better because somebody else does the maintenance of the systems after it's been implemented.
Awesome. So for our listeners, I guess before we go into a little bit more about the whole technology side that you're involved with, can you tell them a little bit about yourself and, just like a little background and how you got into the role?
Sure. I got into the role of pharmacy informatics back in 2004, and my health system was implementing the computerized provider order entry CPOE, and they asked me if I will coordinate that and build the database and map the database of the pharmacy system to the CPOE system. And working with a consultant from the IT vendor, I did that, and that's how I got into the role of pharmacy informatics. And then after that, they installed a more integrated system, which was Sorian from Siemens, and I got involved in that since my pharmacy and my hospital was smaller of the health system, and we were deemed to be the testing ground for all technology. And I found out that I liked it, so I went to school to do biomedical informatics, and I've been hooked ever since.
Wow. So to back up a little bit about that, I guess what kind of was there any specific things that kind of push you into learning more about healthcare IT? I know that you said that they ask you to do the project, but you could easily have said, "Oh, it's okay, you don't have any interest in that." But I guess what was it that made you interested in even agreeing to start that CPOE process?
Well, when I sat down with the consultant, I was looking at the database and how everything interrelates, and that's what got me hooked into it because of how I saw that being in IT and being in pharmacy kind of marriage the healthcare perfectly, and that you have so much more information as a IT pharmacist than you would with just being either IT or pharmacy. So I was kind of like that bridge, and I thought that was a very interesting place to be in that bridge at the beginning of a technology that was just evolving at the time, because back in 2004, not many people were installing CPOE, and there was no meaningful use, there was no high-tech act, there was no stimulus that were pushing people to install information systems like that. So that was more like, oh, wow, you can mirror those two items. So that was what got me hooked.
Okay, awesome. So you said earlier that you did go back to school for I think you said a master's in biomedical informatics. Was that right?
Yes. I went to my old alma mater, which was Nova Southeastern University, and did the master's in biomedical informatics. And that opened my eyes even more to the possibilities of informatics.
So I guess how did your master's program, how did that kind of improve upon what you already know about pharmacy informatics? And did it kind of help you kind of do better in what you're doing today?
Oh, definitely. It actually helped me in understanding the bigger picture more. Before, what I understood of pharmacy informatics was more of the maintenance side of it, of the implementing it, and leaving a lot to IT to decide on how to implement systems for pharmacy. because really nobody knew what it took to implement a system, like the project management of it and so on and so forth. By doing that program, and it just so happened right around the time that I was finishing, they were doing another, which was a Cerner implementation, and I understood a lot more on how to implement properly an EHR and what went into being prepared and training of the staff, the behavior that we need to watch out for, and how to really tailor your implementation to your users. So that did help tremendously in helping me see all that and also see all aspects of the behavioral health and in health IT.
Awesome. So are there any interesting projects that you worked on that you want to talk about, or maybe anything that's coming up?
Well, the EHR implementation was very interesting in that and how they went about it. That was interesting. Right now, I'm working on clinical surveillance programs implementation. However, we are in the very, very early stage. We just picked a vendor, and we're in the early stage, so I don't know how that program will go.
Oh, okay. So your role right now is a director of pharmacy, right? So are you still doing a lot of the pharmacy informatics side? I know you said that you have someone like kind of dedicated to that, but as a director of pharmacy, are you still being part of those discussions?
Yes, right now, what I do is more the implementation side to look at, to do and assess which system is needed and what is needed for the health system in terms of technology. And once that's done, to go ahead and work with the vendor and implement that system throughout the health system. And once that's done, then the pharmacy informatics team go ahead and maintain the system. So right now, I'm more of an implementation role rather than the building and the maintaining of the system. I don't maintain the formulary or anything like that anymore.
Oh, okay. Also, from my understanding, I think you've stated to me that you teach, right?
Yes, I do. Actually, I'm on my way from the class right now where I was teaching pharmacy and informatics at Nova again, currently to foreign pharmacists. However, starting the fall, it will be the regular B2 students.
Oh, okay. So for you, like in terms of teaching, what kind of the key points are you focused on when you try to provide education on the pharmacy informatics and technology piece in these programs?
Well, my key points when I do that is to make sure that all pharmacists know about pharmacy informatics, because in my mind and from conversation with other pharmacists, I've found that people tend to think of pharmacy informatics as this thing out there that doesn't impact them. You know, the formulary doesn't impact them. The formulary just magically appear in the computer. Nobody does anything to it. So what I try to stress to my students is that everything that you touch in pharmacy is impacted by informatics. Therefore, you need to at least have an understanding on how that works so that you can more effectively provide care to the patient, because informatics is more a safety and quality tool that is at your disposition to use to better educate your patient, to better take care of your patient, and to empower your patient to take care of themselves.
Awesome. That's a really good message. So in your experience, either teaching or as a pharmacy informatics project coordinator, what has been kind of like a standout moment or the most rewarding moment that you can remember?
The most rewarding moment that I can remember is when we did install our EHR in a very short time, and it was a successful EHR. And to me, what made it outstanding was that was the first time that pharmacy was integrated in the process. It wasn't a siloed project. Usually in the past, it would be, okay, pharmacy, you work on this part. You know, lab work on this on their own and everybody else work on their own. However, with this project, because it was a lot more integrated, that everybody worked together, and the fact that pharmacy was kind of like put at the forefront. That's what made it outstanding to me, because finally everybody realized that medication use and medication management was a very, very important part of the health system.
Awesome. So going on to your experience of teaching and then all your vast experience as both, a director of pharmacy and a pharmacy informatics project manager or project coordinator, I guess one of the other things that I get a lot is students or other pharmacists that are just, practicing hospital pharmacy or practicing community pharmacy. They always ask about, how can I get into informatics, or what can I do to better myself, to prep myself to be ready in an informatics setting. So I was wondering what advice you would give to people in terms of like, how can they pursue a way into pharmacy informatics?
I'm glad you asked that question, because a student just asked me that question.
Oh, okay.
Today. Yes. And one of the things that I stress to pharmacists that want to get into informatics is, what do you want to do, right? First, what is it that you want to do? If you want to stay in pharmacy, then a pharmacy residency, a PGY2 residency in pharmacy informatics is the best way to go, because then that teaches you about everything that goes into the pharmacy, like the maintenance of the formulary, all of those hands-on items that you need to maintain a quality system for your medication use process. However, if you want to go beyond the world of pharmacy, you need to do like either a master's in health informatics or in IT proper itself, or in bioinformatics and all of those other informatics programs that are out there. It basically depends on what you want to do. Like, for example, if a pharmacist wants to do pharmacogenomics and work in informatics, just doing a residency in pharmacy informatics may not be enough, because you need to understand the genomic part of the system. So therefore, it's better suited for you to do a degree in bioinformatics. If you want to do more like data analytics and visualizations and all that, and it's better suited that you do an analytics degree with a biomedical informatics degree. So that's why I think that all depends on where you want to go and where you want to be as a pharmacist in informatics.
Awesome. That's really good advice. And I think that's one of the things that I haven't heard many other informatics pharmacists say, just because it's interesting to me, because every informatics pharmacist does something different. Like, I haven't really seen two pharmacists in informatics that do the exact same thing. There's always a little bit of difference. And you bring up a good point in that, you can do general like pharmacy informatics, or even more general as a healthcare informaticist, or even like if you want to focus on data analytics, then there's also a route for that. So thank you for sharing that advice.
Right.
So if people wanted to, I guess, further ask you questions or reach out to you, is there a way that they can reach out to you?
Sure, they can reach out to me on LinkedIn. I'm on LinkedIn. So it's Marie-Elsie, Marie-Elsie Ade, ADE, like the end of a lemonade. That's how you spell my last name. And you can reach out to me on LinkedIn, and I answer you. Like you notice, I pretty much answer within a day.
Yes. Thank you for being very responsive on LinkedIn too. Awesome. So thank you. I'll be putting that into our show notes for anyone who's interested in reaching out. But, to be respectful of your time, I'd also like to thank you again for taking some time out of your busy day to be on the show.
Thank you so much for inviting me, Tony. And I hope everybody got some advice there. And if they need to talk one-on-one, they can reach out to me. But I'm very happy to talk to you and to your listeners.
All right. If you guys like this episode, you guys can subscribe and rate us on iTunes, Stitcher, Google Play, or any of your other favorite podcasting services. You can also follow us on social media through Twitter or Facebook at Pharmacy ITME, or our Instagram at Pharmacy Informatics. And you can also email me at tony@pharmacyitme.com. But thank you again for listening, and I'll see you on the next episode of Pharmacy IT and Me. And remember, technology is the tool, patient care is the goal.